Hello, everybody. We are back here on Healthcare Experience Matters, joined today by Dr. Joshua Schwarzbaum. He is an emergency and addiction medicine physician with St. Barnabas Hospital in New York City. Dr. Schwarzbaum, please let's kick this conversation off by you telling me a little bit about your professional background and how we got to where we're at today.
Yeah, thanks. Thanks for having me. I did, originally I did my residency in emergency medicine. I've always been interested in psychiatry and psychology as well. And so I did my residency initially there. And then I was debating always between going into the psychiatric field as well. But for whatever reason, I ended up in the ER. The places where I've worked in the Bronx have had a lot of psychiatric population as well, low income, low socioeconomic, a lot of comorbidities of medical disease and psychiatric diseases. And it's really fascinating to kind of see how the interplay of, mental health and physical health kind of all plays out. And after I finished my residency, I did a fellowship actually in emergency medical services, EMS, and disaster medicine. And then I subsequently also got board certified in addiction medicine, which was always an interest of mine. So I'm working as well with patients for all different types of addiction. And kind of ever since I started residency, I've been hearing about burnout and that sort of stuff. So I've been looking into that kind of field and mental health, not only amongst patients, but amongst clinicians, whether it really be anyone. And the ER is an interesting place I found because you get people from all different backgrounds, both patients and staff members. You have people from all different cultures that are coming together. And if we can focus on the staff for a second here, but we have people coming from all different cultures, all different backgrounds that may or may not know each other very well, that now need to all of a sudden work together as a team very quickly, really to save people's lives. So how do we create a cohesive group? How do we create a highly efficient team, essentially, that can work together on a moment's notice in life-saving situations where you need to act quickly and there's not too much room for mistakes, type of thing. So it was always something that was interesting to me, because how do you develop that? How do you develop the trust amongst people? How do you get each person to come in feeling well in themselves to be able to give their best? Because ultimately, if I'm not feeling well, or internally, how can I really provide my best care to someone else who needs it at the time? So I've been looking into this sort of field for quite some time in various different aspects of it. It's definitely enjoyable. I remember when I started as a resident, I came home a lot and I was not feeling great. I was not feeling great. I felt like it was very difficult. I would try to give it my all. I would give advice to the patients, and I would find some people coming back the same, day after day after day for the same exact problem, not really listening to what we said. And I'm like, I was thinking, what's the purpose of this? Why am I doing this? Basically, why am I showing up to work, waking up very early in the morning, coming home very late at night, going through this and feeling that I have little to no impact. I went to medical school with the hopes of really having an impact on the world, or having impact, amongst my patients. And I didn't really feel that was happening so much in residency. And then, one day it actually kind of hit me. And I was walking into one of the patient rooms and I realized that I'm not going to be able to change the people around me. There's nothing I can do about the way what people were born into, what their education was, how they were brought up, the life experiences they had. And I realized that the only way for me to leave happy is by looking internally at the end of the day. I can't look externally for it. The hospital may not change. The typical frustrations that we hear about, dealing with various things in the hospital, the EMR, administration, processes, systems, all that sort of stuff, that it's slow to change. I mean, sure, it can help, but at the end of the day, I'm responsible for my happiness. And on the same token, I'm responsible for my sadness, and for really any of my emotions is my responsibility for it. And when I realized this, I really had a dramatic kind of shift in the way I saw myself and the way that I saw other people, in the sense that it was very empowering, because now I can choose how I want to leave the hospital, how I want to take any given day. I could look for the things that make me feel energized and make me feel happy, because they're there. Everything is there in front of us. It's just the things that we decide to focus on. So when I started to notice this and really look into well-being a lot more, it's really kind of changed the paradigm, the way that I've seen myself, that I've seen in patients, seen colleagues, and we've been able to really create cohesive teams and bring people together by making each individual feel their best possible, or helping each individual and helping each individual realize how blessed they are as a person, basically, and what they have inside and how much power they have inside of them. Then all of a sudden we can really bring people together in the best way possible, because then everyone is feeling great, and then we can deliver the best care and still leave work, feeling good.
Yeah, no, that's great background. And it's going to lead up to how the Code Breathe initiative got started, because that I want to be the focus of today's interview for our listeners so they can learn all about it. So first and foremost, just tell us about what the Code Breathe initiative is.
Yeah, so Code Breathe, it's an initiative we started in our ER in St. Barnabas Hospital. It's basically what it is. We take 5 minutes a day we call it overhead, just like when we have a medical notification or a trauma notification, it gets called overhead and everyone stops what they're doing to go, take care of a critically ill patient. So we got introduced to an organization called Veterans Path. They were working with military, police departments on essentially mindful type of breathing. These kind of deep belly breaths that they found helps, and there's good literature to support this sort of stuff as well, that helps people recenter, reconnect to themselves, activate the parasympathetic nervous system, to help calm people down, essentially, to help calm yourself down by taking just a series of a couple of big deep breaths. So we got in contact with this organization. We did a little bit of a training, and then we're trying to figure out how to kind of implement it in the ER. So after speaking with some other staff members and thinking about this for a while, we came up with Code Breathe. So what it is that basically every day, we do it basically every shift, ideally. We will announce overhead in the same way that we'll announce like a medical notification. We'll announce Code Breathe, and no matter what's going on, and we actually specifically chose it to be at one of the busiest times in the ER, that it gives people the permission, the time to go take 5 minutes where we get together, sit down, and someone will have various people, either a doctor, a nurse, a technician, registration, personnel, security, housekeeping. We have really every line of work from the ER has been attending, and we get a different person to lead it every day. We're all kind of just come together for 5 minutes, 7 minutes, and sit down, relax, take a couple of deep breaths, and get to feel, energized, re-energized, refocused, no matter what is going on around us, because that really helps us, reconnect within and to bring our best out to all of our patients and all the rest of the team.
That's great. I love hearing that. I think our listeners really will appreciate knowing about that too, and perhaps something they can implement where they work. Why did you feel there was such a need for this Code Breathe initiative in the first place?
Yeah. So it was actually we got approached by by Greater Hospital New York and to set us up with this organization. So they kind of came to us, but we've always been in our ER. We've always been talking about different well-being initiatives, and this kind of fit in very well. We weren't sure initially how to kind of structure it and everything, and once we heard about it, we're like, sure, let's give it a try and see, knowing that there may be some challenges to implement it and everything. And through a couple of different iterations, we tried to figure out the best way to kind of do it. But inherently, we need the space, we need the time. Like the ER is a crazy, crazy place to work in, especially our ER. There's, a lot of traumas we see, a lot of very sick medical patients. And just, with the population we work with can be frankly difficult sometimes. And it can get overwhelming for the staff. And what can the staff do when they're feeling overwhelmed and when there's still a lot of patients in the waiting room waiting to be seen, or there's a lot of other sick people that are waiting to be seen? How do you keep on giving? If you keep on giving and you're starting to run on empty, there's nothing else to give. If someone comes to ask you for $1 on the street and you don't have $1 in your wallet, you just can't give it to them. So how do we keep people full? How do we keep people, how do people know when they need to reset? And I think I've worked in a lot of different emergency rooms at this point, and it's almost a badge of honor. Like, oh, I haven't gone to the bathroom, or I didn't eat lunch today, or, I've been working for 12 hours straight and then I get to stay for an extra 2 hours to do my charting. Well, it's all nice and fine, but if you're not leaving well, you're not leaving feeling good at the end of the day, then that's a problem. So we need to build in processes in place within our emergency departments, within our healthcare systems, to give people the space to take the time that they need for themselves. And if we're not doing that, we're going to run our clinicians into the ground. And if we run our clinicians into the ground, who's going to suffer? It's the patients that are going to suffer. And there's no other industry really that, people are like, oh, let's work, for the 12 hours straight, not take a break, not go to the bathroom. It doesn't make sense. So let's give people the time specifically to be able to do that. We have to think, complex thinking. We have to make critical decisions. I mean, you want your doctor making critical decisions when they haven't taken a break, like they're not able to think clearly. We need people to think clearly. And the care that we can give and the processes that are in place will all be better when people are feeling better about themselves. So it was kind of a no-brainer. Like, we got to figure out how to do this and how to implement this into our day.
Wow. So well said, like very makes complete sense. Great logic behind it. I'm curious how the feedback's been from participants in the Code Breathe initiative. What kind of feedback have you gotten from those who are participating in it?
Yeah, I mean, it's been great. We have people coming every day. So we'll have, 10, 15, 20 people sometimes coming. I mean, it all depends on how busy it is in the ER as well. We did some surveys initially and to kind of ask people, and some of the feedback we got was like, it helped me relax and calm down. It's learning to take a quick time out during work, even when it's busy. I felt more relaxed. I feel less anxious. It feels very relieving. It gives me time to chill out and time to check in with myself. So those are kind of some of the comments that we got. The surveys that we did were more qualitative. Well, we asked two questions. One of them was, would you recommend this to a friend? And kind of like a net promoter score type of thing. Yeah. And everyone we surveyed said yes. And then we asked, what do you enjoy about Code Breathe, or something along those lines, or what do you find? How do you find it to be helpful? And those were kind of the qualitative comments that we got that I just mentioned. And people are coming back every day. So I know that people like it, because otherwise they wouldn't be showing up. And it's growing. And people from other departments have come, and people from other lines of work in the ER have come. And also on the days that for whatever reason it gets very busy, we chose to have it at 1:30 in the afternoon, because that's a particularly busy time. The question was, should we do it? When should we do it? Should we do it at a time it's not busy? And we decided, no, we're going to do it at one of the busiest times in the day, because we're going to show that this is extremely important to do. And because it's so important, we want it to be specifically at a busy time. So sometimes it actually gets a little bit delayed if it's too busy, or if there's critical patients. We obviously, we got to go save someone's life. We can't say, all right, let's take a couple of minutes to breathe and and put someone's life at risk. But on the days that it's not happening right on time, we'll get people coming up and asking, what's going on? Is Code Breathe happening today? So yeah. It's been a nice journey so far.
That's pretty cool. You talked about some of the feedback. Was there any other indications or signs of its success that you wanted to share with us?
No, I mean, I think that was basically it. We're getting more people that are interested in leading it all the time, and we're expanding it. Initially, when we started it, we did it, Monday through Friday, 5 days a week, just to kind of pilot it and make sure it would fit in. We're expanding it to the nights and weekends now as well. So I think overall it's been successful.
Yeah. And for listeners that aren't familiar, the net promoter score, that's simply in survey taking, just asking if you would recommend this to a friend. It's kind of like a one question survey, right?
Yeah, it's like a one question type of survey where you ask, would you recommend this, type, and and just yes or no, simple kind of question.
Awesome. So what advice do you have to other institutions that might be interested in implementing a Code Breathe initiative at where they are?
Yeah, I would say go for it. First of all, do it. People enjoy it. It brings all the staff together. It doesn't matter if you're a doctor, a nurse, a tech, registration, security, radiology. We've literally had people from all lines of work in the ER and people from other departments. We've had other residents and attendings from critical care, pediatrics, general surgery. There are probably others as well. I'm not there every day, so I don't know, every person that comes every day, but go for it is really my first piece of advice. But after that, there will be some, there's always going to be there's always going to be a reason why not to do this, basically. There's going to be, we're too busy. There's not enough people. We don't have people to lead. You can come up with a ton of reasons why not to do something. And getting over that barrier initially, which is the tough piece. Look for the things or the reasons why you can do it. Figure out the ways that you can do it. And once you figure that out, get a core group of people together that are interested in this. And if you have a core group of people, and ideally someone from a leadership team within the ER or within your department that can help kind of structure this, it will be successful. But you need a core group of people essentially to lead, and it's really not difficult to do. It's something that I'd be happy to kind of help with or discuss as well if you would need.
Absolutely. And I'll include your email in the description of this podcast episode. Dr. Schwarzbaum, when we first kind of got together, you were telling me some reasons behind why you're so passionate for this work. You mentioned, why you got into healthcare in the first place. And you don't feel satisfied when you leave work and you feel like you haven't made an impact. I think that's a message that'll really come across to our listeners. And, is there anything else valuable you want to discuss with us before we work towards wrapping up here?
Yeah, I mean, I think inherently working in healthcare, it gives us the ability to connect to people in a way that you don't really get in a lot of other industries. By virtue of showing up to work every day, no matter what it is that you do in healthcare, you are literally transforming people's lives. And it's not only the lives of the people that you're taking care of, there are families behind it, there are workplaces behind it. And the impact that we're having, it's really exponential, and we don't even necessarily recognize it. So to me, showing up and taking care of people and us feeling very drained at the end of the day, it's unfortunate. And it doesn't need to be that way. And I realize that over time. There's always going to be, things out there that we may think frustrate us. But at the end of the day, if we really are looking for the things that make us energized, if we look for the things that within healthcare about how we can really use our blessings to be able to help someone else. It doesn't even need to be something major. Some of the best days, I'm like, if I help walk someone out from the ER to their car and I get an extra 1 minute to talk to them, like these are the things, if I start to focus on them, that's what makes me feel better at the end of the day. And the things that we think about is essentially what creates our reality. If I think about all day how bad my EMR is, I'm going to leave the hospital feeling that the EMR is terrible. If I and I'll leave feeling terrible, and I won't feel good as well. If I focus on the things that I find value in, that I find, make me feel better, that make me feel happier or at peace or have more of a tranquil mind, and I start to look for those things every day, then those are the things I'm going to leave the hospital feeling. And it's just the situation around me doesn't change. It stays exactly the same. What changes is me within that situation. And you can see, if you're working in the ER or in healthcare, you'll see people with the same disease or the same trauma presenting in very different ways psychologically. We'll have people that are in the same exact car accident, so they underwent the same exact experience. We have one person coming in who's screaming their head off and is, really in a ton of pain, let's say, or just screaming because they're traumatized from whatever happened. And then you have someone else who is very calm and collected, maybe even with the same injury or possibly with a worse injury. But the car accident was exactly the same. So why is it that one person is coming in with, a calm and collected mind and the other person is not? And it's because of how they are within any given situation. So that's true of our patients. It's true of us too. I can't change the ER. I can't change the patients around me. I can't change really much of anything. I mean, I could work to change some stuff, but at the end of the day, what's the easiest thing for me to change? It's myself. It's my approach to how I look at things, to what are the things that I look at, to what are the things that I think about, and what are the things that I focus on every day. So all of a sudden there now, the whole paradigm shifts from the work being overwhelming to, anything else, to me saying, well, it's how I think about the work. It's how I think about my patients. And if I find and if I look for and find the beauty and the love and understanding and compassion that is built into every one of us, I can connect with people on a much deeper level, essentially. And when I can do that, now everything shifts, because it's not just another patient in front of me, it's another person. And the amazing thing about healthcare too, and we see this firsthand, and especially in the ER, we see people born. I mean, I may go from seeing someone being born and dying on the same exact day, which is kind of incredible. The ends of life. We all come into the world in the same way. We all leave the world in the same way. It's everything in the middle that's kind of going to be up in the air, and that shapes us. But if you look at even embryonic development, I mean, you go from one cell to all of a sudden a whole differentiated person with arms and legs and a nose and ears and mouth and internal organs, liver, heart, kidneys, spleen, everything. You can go on and on. How does this all happen? How does this whole thing happen? There's something powering this whole universe behind us, some spiritual energy, some spiritual force, whether you want to call it the spirit, the God, the universe, the universal intelligence, whatever it may be. Each of us has that within us by virtue of being born and by virtue of being human. We are, it's all part of us. So if it's all part of us and I can connect with someone, and we all have the ability to connect with someone on that level, it all of a sudden changes the way that we feel about other people and the way we feel about ourselves. And it's incredible. And for me, it's just transformed the whole way that I show up to work every day and the way that I leave work every day. And it's given me an amazing toolkit to be able to approach my patients and their family members, because I just see them differently. And when I see them in that light, all the other stuff kind of falls off. And then that connection is just there. And it's nice. That feels good.
Wow. Great conversation today, talking with Dr. Joshua Schwarzbaum. He is an emergency and addiction medicine physician with St. Barnabas Hospital in New York City, the Bronx to be exact. Dr. Schwarzbaum, this has been very inspiring, and I really, really enjoyed having you break all these things down for us with so much logic and great insight. I appreciate your time.
Yeah, thank you so much. This was nice. I had a good time. Thank you.